Can your patients clean their all-on-X solutions? Now, there are cases out there where the prostheses that we deliver to a patient are extremely easy to clean. And there are solutions out there that are not. And let's just take a moment to talk about the two main ones that we have that people talk about. We call it FP1 versus FP3. Now, an FP1 is what you would traditionally call regular crown and bridge. If you were doing a 3-unit with one pontic on natural teeth, you'd have a pontic in the middle that would go into the soft tissue. It would be ovate, and it would create a beautiful papillary fill, and you'd have a great solution, right? That's an FP1 if you do that same thing with implants. Now, with an FP3, typically you have white and then some sort of pink that makes up for the papilla. And that means that your prosthesis is typically taller, and oftentimes the intaglio surface of that is flat. All right? Now, here's the rub. Many people like the concept of the FP1 because they don't want to remove bone, and that's valid. We can all understand that. There's no problem with that. The challenge is that most people that need a full mouth reconstruction have a history, and that history is either poor hygiene, it's either poor genetics, or it's some kind of habit, right? Sometimes it's a combination of those three, but those are the three that you immediately would say that's what they have. Many of those things don't change when you go to an all-on-X solution, right? Those kinds of things oftentimes don't change, right? So what does that mean? Well, if they have poor hygiene and they're just not inclined to pick up a toothbrush, okay, when you give them a prosthesis for an all-on-X, it would be wise to give them a solution that would be as easy to clean as possible.